after any questions in Spanish by the Long Beach Health Department, and we have Paola also doing our ASL translation today. So we have a lot to go over today, but I want to thank everyone for tuning in, and we are doing our regular updates every Monday and Thursday at 3 p.m. So it's Mondays and Thursdays at 3 p.m. Want to start today, of course, with data. We have now over 6,500 residents total that have tested positive for COVID. We have sadly lost 159, almost 160 residents to COVID-19. Again, continues to be the leading cause of death for us here in Long Beach of any of the major statistics that we track about folks losing their lives. So we know COVID continues to be very serious. We also want to just note that we reported last week that our positivity rate, essentially the percentage of cases that are tested and come out positive, was at 15.2% as far as the 7-day average. I understand as of today we're down to 14.1. So it's dropped about a percentage point. That's a good sign. It's still a lot higher than we'd like it to be, but we want to continue to drop that number down. And we obviously are doing a lot of testing, which I'm going to talk about in just a minute. We want to keep putting that number down. I also just want to remind folks, and I think everyone knows this, to please continue to wear your face coverings or masks when you are around really anyone that's not a part of your household and your family unit. We're learning more and more about face coverings and masks, and they actually do work. And so we all know that. We know that the science has been there for a while. So please continue to do so. And I just want to thank our businesses. We have actually visited over 700 businesses in the city of Long Beach just over the last couple of weeks. That's 700. And a vast majority, I want to say something close to 90% of our businesses were following all of the rules as it relates to masks, as it relates to distancing, and those that weren't quickly have complied and are complying. But a vast majority of folks in Long Beach, especially our businesses, are following the rules. It's not perfect yet, but we want to continue to encourage small business owners and, of course, the public to continue to keep everyone safe, and I want to thank everyone for that. I want to talk about testing a little bit because there's been some improvements, and I want to share what we're doing. The first is just the last few days, we permanently bumped up our testing capacity. So we were doing on average 1,000 tests every day. Then we temporarily, for a few days, had bumped that up a couple hundred to see how we could handle the capacity. And now, because of our ability to handle that capacity, we are now permanently moving forward doing up to 1,400 tests a day. So we were doing 1,000 a day. Now we're doing up to 1,400 a day across the city of Long Beach. That's important because we know that more folks want testing. If you remember a couple weeks back, we were starting to really see a crunch at our testing centers where a lot of folks thought they couldn't get an appointment. We understand now that has really come around, and we've resolved a lot of those issues. There's still, for some wait to get a test, but it's dramatically decreased. We're actually putting up about 1,000 to 1,200 tests become available every single day. And so we're opening up tests every morning. They go on, and people can get tested if they need to. So please, most importantly, if you're symptomatic, you need to get a test. If you don't have symptoms, obviously you can still get tested if you think you were exposed or if you think you need that additional support. But please, if you're symptomatic, get a test. And we're now up to 1,400 every day. Now that's significant because the state's requirement for us, or the state's recommendation for Long Beach, is to do 750 tests a day. So the state recommends us to do 750. We're doing 1,400, which is essentially almost twice the state requirement. And I want to thank all of our staff that's working at all of our testing centers who are doing a great job. You can expect to see even more testing in the future. We are currently, as you know, testing at the Long Beach City College Pacific Coast campus, the Veterans Stadium campus, so both campuses at the college. Cabrillo High School, we have a great testing center on the weekends there, and Jordan Plus High School as well up in North Long Beach. So all those continue to be open. We also want to make sure that folks are getting access to these tests by going to the website, the longbeach.gov COVID-19 website, and all the testing information is there. If you're symptomatic and you need a test that day and you couldn't get an appointment, we do have walk-up appointments available at the Pacific Coast Campus, Long Beach City College. That Long Beach City College, Pacific Coast Campus on PCH, they do day of walk-up appointments. You just have to get assessed at the clinic we have there on site, and you can get your appointment. So sometimes I'll hear from folks, I really need an appointment tomorrow, and I can't get an appointment for a day or two. You can go to Long Beach City College Pacific Coast Campus. We have, in conversations with our partners at the state and regionally, probably one of the better testing operations of any city of our size in the state, and we'll continue to push to make it even better. One thing you're also going to see in the weeks ahead is we want to expand testing, but we also know that the testing is going to change. And so we're partnering with different private providers. As you know, CVS's now do tests. We're also talking to a couple private providers that will come in and probably provide large, more drive-through-like testing experiences for those that are going to directly use their insurance or want to pay for their test or need a test immediately. You'll be able to go to a private provider through your insurance. But of course, we will continue our capacity of the free testing for anyone, whether you're insured or not, and that will continue through the city as a service. We don't want to decrease our capacity, but we want to increase some of these private providers as well. And again, you're seeing that partnership at CVS and other places. Rite Aids now are expanding into that as well. Now I want to just get into our schools. You all heard that last week, Long Beach Unified announced that they're starting virtually in the fall. And so they have not yet said if at some point in the semester that will transition to in-person classes, but virtually that will start, and that's now happening per the governor statewide. The governor also put in place some essentially statewide mandates as to when schools can actually reopen. And so in order to resume in-person classes, a county must have been off the state's COVID watch list for essentially 2 weeks. And after you're off that 2 weeks, you'll be able to transition back to in-learning classrooms. And when we do, face coverings will be required for all students in third grade or older. And of course, for teachers and staff as well. And so those are changes that we're going to see to our school year. We cannot get this economy back on track until we have our school systems back on track, and parents can get back to work and know that their kids are safe, and that they're having to also take on so many more responsibilities, as we know, through teaching their kids as well. And so we know that we've got to work with the governor and the state to make sure we provide safe schooling for everyone, and for now it's going to be virtual. Want to also just add that we have a couple of announcements. Our city budget will come and be presented at the beginning of August. We have some huge challenges because of COVID-19 this year as it relates to revenue, but the city team is working on putting the final touches on the city budget, and that budget will be presented to the Long Beach City Council at the end of this month, as we start the August month. There is a budget survey that if anyone wants to get involved and to respond to, they can go to the longbeach.gov website and give comments or thoughts about what you'd like to see as the budget moves forward. And those comments are then given to the council because, as you know, the city council are the final decision makers as it relates to passing the budget. And so they'll have a chance to make a bunch of adjustments to the Long Beach City budget. And that website and that survey is available in English and Spanish, Khmer, and Tagalog. Also want to just announce that this Thursday, we're hosting a Khmer speaking residents, a Cambodian leader conversation about COVID-19. So this virtual town hall is this Thursday, July 23rd at 5:30 p.m. Be live streamed on our city's social media channels, but the entire conversation will be in Khmer. We do have a significant Khmer-speaking Cambodian population, and so that's coming up this Thursday, and we've been working a lot with the Cambodian community to make sure that they understand and know all the resources we have around testing, and they've really been great advocates to work with, so I want to thank them for their support. I'm going to turn this over to Dr. Davis in a minute, but in closing, I just want to just thank everyone for their amazing notes and messages over the last week. A week ago, I shared with all of you that both my mom and my stepdad were both hospitalized, both on ventilators, who both had tested positive for COVID-19. And while my mom, of course, has been a healthcare worker for 25 years and is just the most careful person that I know in my family about COVID because of her work, they still, obviously got COVID, and it could really happen to any family. Like I mentioned in a message I put out over the weekend, your notes and messages and your kindness has been just so appreciated by my family and by my brother. They both still are on ventilators, but they are making some progress, and that is some good news. Obviously, we know that this virus is it's very difficult to predict because it's still so new, and so I'm in constant communication, of course, with the nurses and doctors who are all just doing heroic, amazing work. And I just wanted to end by just thanking all of the nurses, the medical teams, the doctors, the clerks at all of our hospitals that are our heroes and that are not just doing amazing work for folks, for my family, but for all the families that are out there that have parents or grandparents or relatives or friends that are in our hospitals receiving amazing, amazing care. And I will share with you that the nurse, I talk to our nurses every day, and what they've shared with me is they want to continue to pass along the message to all of you to please stay safe, and that they need your support. They are also tired, and they also want to see their families, and they are dealing with COVID-19 in a way that all of us are not. And so let's support these healthcare workers by staying safe, by making sure that we are keeping our hospitals at a level where they can manage the impacts, and let's continue to do the right thing and make those personal sacrifices that we all need to make right now for the greater public good. And so thank you again for your support, and I want to turn this over now to Dr. Davis, who's going to give some other updates, and then we'll answer some questions. Thank you.
Thank you, Mayor. I'm glad your family's doing better. Good afternoon. Last week, our Health Department Director, Kelly Colopy, shared with you some data regarding the trend we're seeing in the age of those testing positive for COVID-19. So currently in the month of July, nearly 60% of COVID-19 cases occurred in people under the age of 40 years old, compared to only 41% in April. And the median age of newly diagnosed cases went from 52 years of age in early April to 33 years old currently. We've seen an increase in community hospitalizations, meaning hospitalizations not associated with patients in long-term care facilities, such as skilled nursing homes. The number of community hospitalizations are nearly 3 times what they were 1 month ago. Right now, our death rate remains relatively stable, but it is a lagging indicator of coronavirus spread. Usually, we'll see the number of cases go up first, and then the number of hospitalizations, and then the number of deaths. While we don't know exactly all of the reasons why the cases in younger people are increasing, we do know that many infected people are indicating that they attended a social gathering in the week or so before getting sick. Birthday parties, barbecues, holiday gatherings, etc. And we've also seen at work sites that employees do really well at adhering to all of the precautions while they're working, but tend to let their guard down during lunch and break time, and can sometimes expose or infect coworkers that way. So it's important to remember that events and gatherings are still prohibited in the city of Long Beach. If we're going to slow the spread of COVID-19, we all must do our part. The best way to protect yourself and others is to limit your interactions with other people as much as possible and take steps to minimize viral spread when you can't avoid those interactions. Remember to practice the 3 C's: avoid crowds, confined spaces, and close contact. And keep practicing physical distancing, wearing your face coverings, it's very important, and washing your hands frequently. So now I'd like to discuss contact tracing a little bit. Another tool to further prevent the spread of COVID-19 within our community is contact tracing. Contact tracing is a simple, confidential process that's been used by public health departments for decades to slow the spread of infectious diseases and avoid outbreaks. The more people who cooperate and submit information, the more lives we're able to save. Our current contact tracing system allows us to conduct case investigation and contact tracing by telephone or by our new online survey system, which I'll get into in a little bit. Data that's collected is kept confidential and protected by California's strict privacy laws and will not be shared with any other city department. The data is only collected and stored for use by local and state public health departments. Your identity and health information is always kept private. It will not be shared with anyone who may have been exposed. You will not be asked about your immigration status during testing, care, or any follow-up calls. You'll also never be asked for your Social Security number or payment, financial or banking information. So last week we launched another way to get information about those testing positive, and this is our online survey. And this is in addition to the phone calls that we've already been making directly to people. So when an individual tests positive at one of our city test sites, they'll receive a link by email to an online case investigation form asking about what symptoms you may have, when you first developed them, and who you were in contact with while you had symptoms and within the 48 hours before you started showing symptoms. It's very important. We really need people to fill out the survey quickly and completely in order to identify people who may be positive, in order to get them tested and in isolation or quarantine to prevent further spread of the virus. Remember, you can be contagious for up to 2 days before you start showing symptoms. So the sooner we can get to you and either have you tested, isolated, or quarantined, the more spread that we'll avoid. Once close contacts are identified, individuals will be contacted by a public health worker who will let them know that someone they've been in contact with has tested positive for COVID-19, and will help them understand their next steps. Remember, they will not share information about who may have exposed them. This information is confidential. No names will be given out. Those who are identified as contacts will be prioritized for testing. And since February, 11.5% of those contacts who were contacted by the health department have ended up testing positive for COVID-19. So it is a very important tool to use in order to quickly identify additional cases and help them to become isolated. Thank you very much.
So we have a couple questions. Our first question is from Haley with the Press Telegram. Haley, go ahead with your question.
Hi, I actually have 2 questions for Dr. Davis. So first of all, in light of the news that Long Beach will be ramping up testing capacity, I know that, you know, in prior weeks, whenever Long Beach increased the testing capacity, it caused some delays and backlogs in private labs. So is that a concern? And then my second question is just, can you speak to what the local capacity or hospital capacity is right now?
So your first question was regarding if there would be backlogs because of the ramp up in testing. Did I understand that right?
Yes, yeah, is that a concern?
So we've been working really closely to identify the best labs in order to get really good turnaround times. And we continue to kind of monitor that. So for right now, we have really good turnaround times, even with the increased capacity, and we will really watch that closely because it is a very important indicator to be able to get in touch with people quickly. So far, it's been going well. And then your second is hospital capacity. So the hospital capacity for our area hospitals, we've been stable. We're at 60%. So that is good news. And so we just all need to really, I think everybody is playing a part in that hospital capacity. I think hospitals are doing a lot of planning around making sure that they have enough bed capacity and enough staffing for those beds. And then we really need for individuals to be wearing their face coverings and not doing social gatherings and be careful when they are out in public. Because that's really how we will decrease transmission and then decrease the number of people who end up needing to be hospitalized.
Our next question is from Valerie with the Long Beach Post. Valerie, go ahead with your question.
Hi there. So I also wanted to ask about hospitalizations. So you said that the hospitalizations were stable at 60%, but you also said that they're 3 times the number of hospitalizations than a month ago. And a month ago, I think I recall you guys saying that hospitalization area capacity was also at 60%. So I'm just kind of curious as how the capacity is staying stable if hospitalizations are up by 3% or by 3 times.
Right. So I think what is happening is that hospitals are kind of prioritizing, putting off some elective or procedures that are able to be deferred, bringing in more staff, because basically what capacity is beds that you're actually able to use because you have the staffing. So it's not just the beds, but it's also having the workers present. And so what hospitals throughout the region have been doing is really making sure, shifting things around so that they can use more beds and then bringing off more staff to staff those beds. So right now things look really stable, and we'll have to continue to really monitor because, of course, all of those things have finite numbers. But right now we're doing pretty okay with that.
Perfect. And then we have a couple of questions from Facebook. Our first one is for Dr. Davis, and it's, I don't have symptoms, but I may have been exposed. Should I get tested?
So the state recently put out a new prioritization or an updated prioritization. So the top priority is, of course, those with symptoms. And then the second priority is asymptomatic individuals in a couple of classes. One is an asymptomatic individual who is a known contact. So I don't know how likely your exposure was. If you know for sure that somebody that you worked with or that you live with or that you were around, and again, the definition of a close contact is being within 6 feet for greater than 15 minutes. So if you know somebody tested positive and you fit that criteria, then yes, you would be in the category to get tested. If you work in a high-risk setting, then that can put you in a category, so a healthcare worker or another setting where you're in close contact with people. And then say you don't have any of those things, but you still feel like you may be exposed. There are several testing opportunities that the mayor described where you would be able to still get tested.
Perfect. And the last question is for the mayor. Mayor, can renters still get help?
The question, can renters still get help? I mean, the answer to that is locally, yes. I mean, there's a couple things. I think one is the city extended its eviction moratorium by another month and continues to monitor that. So that's happened. We also have a rental assistance program, which if you go to longbeach.gov, it's a program where you can apply. I'm trying to, I don't have the date on the top of my head about when that opens or closes, but we'll put that out on the website or out later today. But there's a rental assistance program that allows people to come in and sign in, and there's a lottery system for that as well. And there's a lot of other tenant and rental programs. If someone has any questions and they call the 570 info line, we can connect them to any of those resources. But more broadly speaking, we are working on a bunch and really pressing also Congress and the state level. We need an expansion of the extension for the unemployment benefit that a lot of folks are getting. That's being debated right now in Congress. It's just it's ridiculous that they haven't extended that. People are expecting that support. We need all workers need an additional $2,000 a month, in my opinion, to provide them with the ability to live when they're unemployed and not having the ability to make additional income. So that's something that we're pushing for Congress. And so there's a debate right now about what the next recovery package is going to look like. And we have to continue to act and push our representatives to do the right thing for workers, for renters, for those that are unemployed and that really need additional support right now. So we'll continue to do more. We have to do a lot more. I want to add one thing back to what Valerie mentioned on the question around hospitalizations, because I ask this question every day, and I think that everyone's sick of me asking the question in different ways. I also have asked the same question. Well, why is it that the number of folks with COVID that are hospitalized has increased, but the percentage of available hospital beds has remained around the same? And I mean, the main two kind of responses I get is the first one is, I think Dr. Davis is right, that the hospitals are managing other patients that are not COVID related. So even though the COVID patients might be increasing, other patients in the hospitals might be decreasing. And then the other piece is as a reminder to the media is that we don't put these numbers together. I mean, we get the numbers essentially sent to us by the state, and the hospitals report those numbers to the state, and then the state reports those numbers out. And so we are providing you with what we get, but we are of course working with our hospital partners just to make sure that all the data is being submitted correctly, so that we have a clear picture of where we are. And so I think that's a really good question, because I ask it all the time as well. And I think it's good to have a critical lens on it, because I think it's important, because oftentimes what we hear from hospitals or from the nurses on the ground might look different than what we're getting in the state numbers. And so I appreciate the constant kind of push on that question. I think that wraps up. So we're going to go ahead and do our translation in Spanish. So thank you.
Buenas tardes. Hoy es nuestra sesión informativa para el 20 de julio de 2020. Empecemos con datos generales. Hasta hoy, 6,522 residentes han dado positivos por COVID-19. Esto incluye un aumento de 673 casos desde nuestra última conferencia de prensa el martes. Además, aproximadamente 4,955 personas se han recuperado. Hemos perdido 159 residentes de Long Beach por COVID-19 y 118 de estas muertes se han asociado con centros de enfermerías de largo plazo. Queremos informar que la ciudad ha visitado más de 700 negocios y el 90% de estos están siguiendo las reglas. El 10% fueron reglas mínimas y regulaciones que están cambiando para estar a la orden. Recordamos que las pruebas son críticas para prevenir la propagación de COVID-19 y seguimos ofreciendo pruebas gratuitas para los residentes de Long Beach y ciudades cercanas. Esto incluye Signal Hill, Lakewood, Compton y Paramount. Se han hecho algunos cambios en las horas de prueba de COVID-19 operadas por la ciudad. Las pruebas ahora están disponibles de la siguiente manera. El Colegio de Long Beach, el campus localizado por la Pacific Coast Highway y Orange, va a estar abierto de lunes a viernes de 10 de la mañana a 1 de la tarde. El estadio veteranos también de la ciudad del Colegio de Long Beach estará abierto de 10 de la mañana a 1 de la tarde y de 3 de la tarde a 5. La Escuela Secundaria de Cabrillo ofrecerá también exámenes de 10 a 1 y de 3 a 5 los fines de semana. Las horas en Jordan Plus High School permanecerán sin cambios y ofrecerán pruebas para individuos sintomáticos y trabajadores esenciales de 7 de la mañana a 7 de la tarde, de lunes a viernes. Tendremos ahora una capacidad de más de 1,400 pruebas por día. Esto es doble requisito del Estado. El Estado requiere que tengamos 750 exámenes por día. Todavía se requieren citas para las pruebas y se pueden hacer en línea o llamando al 562-570-4636. Citas estarán disponibles con hasta 3 días de anticipación. Las citas sin cita previa están disponibles en la clínica de evaluación rápida para personas que tienen síntomas. Esta clínica de evaluación rápida está localizado en Long Beach City College, el campus por la Pacific Coast. Continuará con pruebas no basadas en vehículos para pacientes con síntomas. Será de 10 de la mañana a 2 de la tarde entre semana. Para aquellos ustedes que no pueden conseguir cita y tienen síntomas, esta sería su mejor opción. También pueden recibir las pruebas COVID-19 a través de su proveedor de atención médica. Recomendamos que aprovechen esta opción también. Farmacias como CVS y Rite Aid también están ofreciendo pruebas. Información sobre las escuelas. El viernes pasado, el gobernador Newsom anunció nuevas pautas para determinar qué distritos escolares pueden reabrir las clases en el otoño. Para reabrir la instrucción en persona, un condado debe haber estado fuera de la lista estatal de vigilancia COVID-19 durante 2 semanas, 14 días. Los distritos de la lista de observación solo podrán realizar aprendizaje a distancia. Se van a requerir cubiertas faciales para aquellos estudiantes de grado 3 y mayores, tercer grados para arriba, y se van a recomendar para aquellos de kinder a 2º grado. Todos los maestros y el personal tendrán que usar las mascarillas. Además, el gobernador anunció nuevas reglas sobre cuándo las escuelas tendrán que cerrar de nuevo. Cuando un corte de clase debe irse a casa cuando hay un caso confirmado de COVID en ese corte. Una escuela debe cerrar cuando múltiples cortes tienen casos o si más del 5% de la escuela es positiva. Y un distrito escolar debe cerrar si el 25% de sus escuelas están cerradas dentro de un periodo de esas 2 semanas. El Distrito Escolar de Long Beach ya había anunciado que las clases en persona no comenzarán hasta al menos el 5 de octubre. También queremos recordar a todos que estamos en medio de nuestro proceso de desarrollo del presupuesto para el año fiscal 2021. Los invitamos a completar nuestra encuesta de presupuesto que ahora está disponible en línea. Para encontrar la encuesta de presupuesto en la página de inicio del sitio web de la ciudad, localizada en www.longbeach.gov. Queremos mencionar que también habrá una junta con la comunidad camboyana sobre el virus que se transmitirá en vivo en la página de Facebook de la ciudad de Long Beach este jueves 23 de julio a las 5:30 de la tarde. El alcalde también dio gracias por los buenos deseos para su familia y dando gracias a todo el personal de los hospitales que están cuidando a los enfermos y dando un cuidado excelente. Vamos a apoyar a ese personal asegurando que continuemos con una distancia de 6 pies, que estemos usando las mascarillas cuando estemos en público, lavándonos las manos con frecuencia y desinfectando las superficies de alto contacto. La semana pasada se los compartió algunos datos preocupantes sobre la tendencia que estamos viendo en la era de aquellos que dieron positivos para el virus. Actualmente, en el mes de julio, casi el 60% de los casos de COVID-19 ocurrieron en personas menores de 40 años, en comparación con solo el 41% en abril. La mediana edad de los casos recién diagnosticados pasó de 52 años de edad a 32 años actualmente. Hemos visto un aumento en las hospitalizaciones de la comunidad no asociados con pacientes en centros de enfermería a largo plazo, como hogares de personas mayores. Mencionaron que esto se debe a las personas que se están juntando en reuniones como fiestas de cumpleaños, reuniones casuales y también juntándose con compañeros de trabajo durante sus breaks del trabajo. El número de hospitalizaciones en la comunidad es casi 3 veces mayor de lo que había hace un mes. Una de nuestras mejores defensas para prevenir aún más la propagación de COVID-19 dentro de nuestra comunidad es el rastreo de contactos. El seguimiento de contactos es un proceso simple y confidencial que los departamentos de salud pública han utilizado durante décadas para retrasar la propagación de enfermedades infecciosas y evitar brotes. Cuantas más personas responden la llamada, más vidas salvaremos. Los datos recopilados se mantienen confidenciales y protegidos por las estrictas leyes de privacidad de California y no se compartirán con ningún otro departamento de la ciudad. Su identidad e información de salud siempre se mantiene privada. No se compartirá con nadie que haya sido expuesto. No se le preguntará sobre su estado de inmigración durante las pruebas, atención o llamadas de seguimiento. Tampoco se les pedirá nunca su número de seguro social o información de pago, financiera o bancaria. La semana pasada lanzamos una nueva forma de obtener información sobre contactos de personas que dieron positivo. Esto es adicional a las llamadas que se están haciendo cada semana con el personal de salud. Cuando una persona da positiva para COVID-19 a través de uno de nuestros sitios aquí en la ciudad, va a recibir un correo electrónico con un formulario de investigación de casos en línea preguntando qué clase de síntomas, cuándo se le desarrolló por primera vez y con quién estuvo en contacto durante los 48 horas anteriores. Y necesitamos que las personas completen esa encuesta de forma rápida y completa para identificar a las personas que pueden ser positivas a fin de que se haga la prueba, estén aisladas o en cuarentena para evitar una mayor propagación del virus. Recuerde, puede ser contagioso hasta por 2 días antes de comenzar a mostrar síntomas. Incluso si se siente bien, aunque sea asintomático, puede transmitirlo a las personas que lo rodean, por lo que es esencial que siga cooperando en el proceso de localización de contactos para proteger a los demás. Una vez que se identifiquen los contactos cercanos, un trabajador de salud pública se comunicará con usted para informarle que alguien con quien ha estado en contacto ha dado positivo por el virus y lo ayudará a comprender los próximos pasos. Recuerde y le repetimos que no compartirán ninguna información sobre quién puede haberlo expuesto. Esta información es confidencial y no se puede compartir. Desde febrero, más del 11% de las personas contactadas por el Departamento de Salud terminaron dando positivo por COVID-19, enseñando que esto es una herramienta importante para asegurar que estamos informando a la comunidad si han sido expuestos. Eso es todo por hoy. Muchas gracias por acompañarnos.